Buenas tardes a todos. Ya vamos a comenzar con la reunión en unos minutos más. Les recuerdo que NeuroTechX es una comunidad internacional para el desarrollo de la neurotecnología. Y en esta ocasión vamos a presentar un resumen de todos los avances importantes del año pasado. En unos minutos más comenzaremos. Good afternoon, everybody. We're about to begin with the conference. NeuroTechX is an international community for the development of neurotechnology. And in this occasion, we're going to present a review of all the great advances on the field that occurred during 2020. We're about to start in a few minutes. NeuroTechX, la comunidad internacional para el avance de la neurotecnología, cumple 5 años y está orgullosa de presentar a su capítulo LATAM a la comunidad. Si están interesados en formar parte, no duden en ponerse en contacto con nosotros. Somos una red de voluntarios de todo el mundo con más de 30 capítulos distribuidos a lo largo del globo. En unos minutos más comenzaremos. Les recordamos que el evento está planeado para desenvolverse tanto en inglés y en español. NTX is the largest community of the advance of neuroscience, just celebrated 5 years, and is proud to present the new LATAM chapter to its community. If you're interested in joining us, please get in contact with us. We are a network of volunteers with more than 30 chapters around the globe. We're about to start in a few minutes. We remind you that the language of the event will be English and Spanish. Hi, so thank you all for coming. The Buzzing Review is finally here in LATAM. Please make sure to let people know that you're joining us by using the hashtag NTXBIR 2021 in all your social platforms. And now, please let me introduce you to our first guest of today. His name is Brian. Brian, please join us. You can turn on your camera, please.
Great. Hello, everyone. Thank you. Let me just get my screen shared here for everyone to see.
Great. Thank you, Brian.
Thank you. Excellent.
I leave you with the presentation.
Wonderful. Thank you so much, Manuel. And thank you to everyone on the call today. It is my distinct pleasure to be able to launch NeuroTechX's Buzz in Review 2021. This is our flagship event series. It actually started as a pilot series in 2017 before we then rolled it out for its inaugural year last year in 2020. So it's with much excitement that I'm here today to announce the 2021 version of the series, but also to announce LATAM, our newest community in the Chapters initiative. And of course, to introduce everyone to NeuroTechX, which is the largest international community for neurotechnology enthusiasts. We are a volunteer-led bottom-up organization with the mission to facilitate the advancement of neurotechnology. Now, this is a broad mission by design. We aim to have a 360-degree full, complete impact on the field of neurotechnology as it grows. We do this through 3 pillars: our community pillar, our education pillar, and our innovation pillar. Now, within these pillars, we have many different volunteer initiatives, which I will highlight momentarily, one of which, of course, is events like these. But this is basically built upon our principle that through educating and informing a strong community, we will ultimately be able to inspire those individuals to develop professionally towards solving today's challenges using neurotechnology. So this graph here is just to represent all of the wonderful communities that we have in the neurotechnology, in the NeuroTechX family, in the NeuroTechX ecosystem. We have a reach of over 16,000 members around the world now, including over 5,000 members in our online community, which the link to is being shared in chat stream as well. We have 13 volunteer-led initiatives now within and spanning across those 3 pillars that I mentioned previously. These include initiatives like our education initiative, creating a platform for people of all knowledge levels of neurotechnology to be able to grow their knowledge. Similarly, we have our newly minted diversity committee looking to create opportunities for equality and inclusivity in this burgeoning field. And finally, we have, and most relevant for today at least, we have our chapters initiative, which spans over 25 chapters, actually nearing almost 30 chapters now, as Manuel alluded to. And we've run almost 300 global events since our inception in 2015. So truly a strong presence. And I'm just so thankful to work alongside everyone in the chapters initiative as Connectome manager, overseeing the committee, steering the chapter's activities, and of course, all of the chapter leads on the front line of creating such a fantastic community. So thank you again for being here. Truly appreciate it and hope you enjoy. I will hand it over to Cesar to kind of kick off the festivities and begin our highlight of the greatest neurotechnology from 2020. Cesar?
Okay. Hola, toda Latinoamérica. I'm Cesar Echavarria. I'm a Mexican neuroscientist at Harvard University, and I'm very excited to share with you the latest and greatest news from the field of neurotechnology. This is a very rapidly expanding field, and it's gaining a lot of potential. And I hope that this presentation, however brief, is excites and inspires students, professionals, and enthusiasts across the region to take on the challenges of developing these technologies. So with that, we'll start the presentation. Here you go. So the first piece of news from 2020 is from Kernel. If you're not familiar with it, this is a LA-based company that's developing non-invasive brain-computer interfaces. So this is devices that don't require you to go into the skull and they allow you to record brain activity. Kernel has two devices, as was revealed this year. One is based on measuring the magnetic fields around the skull that are produced by electrical brain activity from within the brain. And the second is Kernel Flow, which is based on reading brain volume signals from across the scalp, which are indicative of brain activity. And in October, there was a great demo by the Kernel team showing this really exciting hardware that they've been developing. And at the end of the presentation, they sort of invited people to submit proposals to suggest ways that this new device could be developed and applications for this signals. And in December, we heard of the of 23 different research groups from across academia and industry that are receiving some of these flow systems to figure out applications and conduct research with them. And that's just very exciting. On a more invasive piece of news, so this other company, Synchron, coming out of Australia, has this stentrode technology. So you may be familiar with stents. They are usually used in the context of heart surgeries to sort of they're inserted from within the blood vessel, and they allow physicians to not just open up blood vessels, but also support the walls of blood vessels. And the Synchron's technology is stents outfitted with electrodes that allow researchers or clinicians to record and stimulate the tissue around the blood vessel. So the idea for this NeuroTech company is to do a semi-invasive procedure, put up a stent through the jugular up to the arteries or the veins, of course, the veins around the brain, and record and stimulate neural tissue around the blood vessel. And this year we saw a lot of news related to this company, but I guess most exciting was that we had the results of the first in-human study published from this surgery. And I just want to show a video from one of the patients that received this device. So there were two patients that received this device. They both suffer from ALS, which is a very crippling neurodegenerative disease. And the device allowed the users to, again, control their digital devices with the use of just signals from their brain. So you can see this patient is not actually holding a mouse or anything. He's just by just a virtue of looking around the screen and thinking, he can shop online, he can send texts, he can send emails, and this technology just really has the potential to improve people's lives. And with more funding and more development, it will only get better. So I'm gonna go back to my presentation now. And in an even more invasive end of the spectrum, so you guys might be familiar with Neuralink, which is the company founded and currently led by Elon Musk. And in 2019, they had their first public event where they showed this new hardware that they were developing, very thin electrodes and a robotic surgery device that allowed very carefully implanting the electrodes within the brain. And the goal of this company is to make invasive brain-computer interfaces accessible to the public with just a very minor surgery. And in the last year, in 2020, in August, we had the second demo of from Neuralink, the second press event from Neuralink, that had a live demo of one of these devices, a Link device in pigs. So we had the story of 3 little pigs. One pig had no implant whatsoever. The second pig had an implant that had been removed, and it was behaving just fine, just showing that this is not a very there's no adverse consequences to having this device and then having it taken out. And the third pig had an actual working implant that it had had for 3 months, and we were able to see a live data stream, and also saw a demo of researchers being able to decode limb position from the brain activity, which was very exciting and just highlights the promise. We have yet to see this devices implanted in human patients, but that's just a matter of time. And we also have some work pushing the development of prosthetics. I will highlight a couple of the very exciting occurrences here. So in March, we saw this regenerative peripheral nerve interface from the University of Michigan, which consists of a small graft of tissue surgically attached to the end of a severed nerve in an amputee's arm. And this is an improvement over previous interfaces because this interface promotes healthy nerve growth and acts as a bioamplifier to convert faint neural signals from the brain into large recordable muscle signals that remain stable for years. And this gives the amputees new intuitive control of the most advanced robotic hands in the market. And now moving on to some research news. So now this may be a little bit further from commercialization, but the events that have come from academic labs they're exciting nonetheless. The first development is from a group from the Istituto Italiano di Tecnologia. They developed conductive temporary tattoo electrodes. So these are electrodes that consist of just of implanting. You insert them under the skin just like a tattoo, and they can be removed after a while. And the advantage of doing that is that you get just better signals, and they're also easier to live with instead of having a cap with various electrodes that patients have to try to go about their daily lives while brain activity is recorded. These are conformed to the skin, and so they're just easier to live with. In a related development, there was also a similar technology was developed by a group from the University of Houston, except without the need to go under the skin like a tattoo. This drawn-on electronics can incorporate a variety of sensors for things like temperature, electrophysiology activity, and can be used to record muscle activity. Now, why is this better than your Fitbit or your Apple Watch, which records things like record things like temperature or heart rate? Well, as you are familiar with these devices, they can be noisy because they sort of have this motion artifacts. If you move your hand too much, they can't get a good signal. In contrast, this drawn-on electronics conform to the skin. And so you can get rid of those sort of motion-induced artifacts and get better signals. Additionally, the researchers reported that electrical stimulation based on this drawn-on electronics demonstrate accelerated healing of skin wounds. We also had some exciting developments in the realm of visual cortical prosthesis. So visual cortical prosthesis are devices that try to restore sight in blind patients. Usually these patients have a damaged retina or a damaged optic nerve, making it unfeasible to stimulate this this tissue. Instead, what researchers do is, they'll attach a camera onto glasses that the patients wear, and they'll implant electrodes over the visual part of the cortex. So that's the occipital part at the back of the head, and they'll have a processor that processes the images coming into the camera at the front, and stimulates the cortex to create images around that the patients report. And by stimulating the tissue around each electrode, patients report spots of light. And in the past, the way that researchers have tried to restore sight is by sort of drawing on the cortex of patients. So if you stimulate in one part of the visual field and you see a spot of light, you can sort of then stimulate the one that's right next to it, and try to maybe draw a square or a triangle. But because the spots of light are sort of they're a little bit unpredictable of how big are they going to be from patient to patient. They have had mixed success with that, and what this latest research tried to do is to, instead of simultaneously stimulate various electrode sites, instead they stimulated over time. So they drew shapes, and in that way people were able to see letters spelled out one at a time, which is very impressive. This is like instead of maybe trying to do a shape C on someone's hand, that might be hard to parse. Instead, what you do is you draw the letter C, and that you can figure out what you drew on that person's hand. And additionally, another piece of information, another piece of news related to cortical prosthesis came from Monash University in Australia, where they have developed just more advanced electrodes and better computer vision technology that will improve the visual cortical prostheses that are currently available for patients to use. And we also have a couple of results related to nerve rehabilitation. So work from a group at the University of Pittsburgh used spinal stimulators to restore the sensation of touch in people with prosthetics. This is similar to the idea of the cortical visual prosthesis that I described before, right? So the people may have nerve damage that that prevents them from being able to have sensations on their limbs or on the prosthesis. And what you do is, instead of relying on those nerves, go directly into the spine. So same concept. And additionally, on another note on nerve rehabilitation was work from APFL in Lausanne, which showed that it's possible to restore mobility in paralyzed rodents. The critical detail here is that the researcher used artificial intelligence to determine which neurons needed to be stimulated to produce this effect. This means that AI-based approaches could make rehabilitation therapies much more effective. Very exciting development. Okay, next I'm going to cover some tech innovations. And I realize that this is very dense material. I'm covering a lot in a short period of time. I invite you to stick around after the event for networking, and I'll be happy to share more knowledge about these things, and I'm sure the other panelists would as well. And also invite you to join the neurotech community, because that's just the biggest source of knowledge that you can have, and people are always eager to share. So 2020 saw the release of various recording and stimulation devices geared towards consumers. So you should expect to see these devices on a brain near you very soon. I want to highlight just a couple of these to be brief. The first is the CETO, the CEEG. This is the first zero-prep wireless EEG platform to receive clearance from the U.S. Food and Drug Administration. This means that this device can be used to perform routine or urgent EEG anywhere without the need of a trained expert. I also want to highlight the BCI, the open BCI device Galea. This is hardware and a software platform that integrates sensors to measure brain activity, muscle activity, skin resistance, blood flow, and night tracking. So all in one package. This hardware will be coupled with augmented and virtual reality head-mounted displays. This hardware is also coupled with a development kit for application development. And lastly, on the stimulation side, I want to highlight this Enero FUS. So FUS starts for focused ultrasound. So you can use ultrasound to very selectively stimulate individual patches of the brain. So this low intensity focused ultrasound device allows you to selectively neuromodulate, to do selective neuromodulation on very specific regions of the brain to get very targeted effects. And the fact that this is going out to consumers is just very exciting. And I guess as I'm talking about these devices, if some of you are interested and your ideas are sort of, ideas are just coming to your mind with ways that you would like to use these devices, I would like to reiterate, the suggestions that you see in the chat of joining the NeuroTechX community, where you will find a great source of knowledge from the people, and there's just so many people that are eager to help you and get your project off the ground and running. We also have news from Paradromics, which is a startup venture with DARPA. They unveiled their largest ever electrical recording of electrical activity using the highest capacity neural recording system. Now, these researchers were able to show electrical activity from over 30,000 electrode channels in chip cortex, and there are plans to use these devices in patients with severe paralysis. We also have news from Gower Labs from London. They released a wearable near-infrared imaging cap for use with infants. So near-infrared is the same technology that that Kernel is using to get brain activity from using non-invasive recording to non-invasively record brain activity. Now, why is this interesting? Well, the infant development is one of the most exciting areas of neuroscience research. And if you think about it, all the things that AI is currently poor at is things that just babies excel at. I mean, babies can learn semi-complex concepts from just a few samples. They don't need millions of labeled samples like the current state of artificial intelligence. So understanding how the brain, the infant mind and brain develop is key to maybe unlocking the potential of some of these technologies. But the conducting this research is very difficult because babies and infants are restless. They'll move around if you put them in an fMRI scanner, or if they have electrodes. So the production of this cap just sort of tries to address that to more effectively record brain activity while babies are exposed to various tasks. And hopefully this will greatly accelerate the research into human development. And with that, I want to hand it up to Nick.
Great, thank you very much. Hopefully you can all hear me all right.
Yeah, one is fine.
Perfect. Oops, that's not what I want to do. I do want to share it, but verbally, not through Google. So my name is Nick Halper. I actually started out as a cellular neuroscientist who ended up starting an EEG lab and used that to start into an engineering position at a company called BlackRock Microsystems, which creates tools basically for people who create brain-computer interfaces, especially invasive ones using the Utah array. And I kind of moved my way from engineering into company strategy and helped kind of shape which types of technologies BlackRock commercialized. And I enjoyed that work so much that I actually started a company of my own called BrainGrid, which we'll be talking about today a little bit later. But for now, I want to guide you through some regulatory approvals. There are some big news in regulatory approvals this year for neurotech devices, which I think is super exciting because obviously you can see a lot of this stuff happen in the lab, happen in research, but it's really nice to actually see it, make it into treatment for people. That's where a lot of this regulatory approval process comes. So we couldn't pick and show you everything that happened this year because there was actually so many different options available. So we just showed you some of the coolest ones. But before I actually jump into the regulatory approvals, I just wanted to do a quick kind of like a, I guess, terminology thing, because regulatory, I think for a lot of people is kind of a weird field. A lot of people throw around terms in it without really talking about what they mean. So for example, you might have heard a big regulatory announcement this year was that Neuralink got their breakthrough device designation by the FDA. And a lot of people hear that and they're like, great, a breakthrough, it's done. I can get implanted next week. But this is not really the case. And I just want to take some time to define them. So in the US, the FDA has kind of two different terms you want to pay attention to. One of them is investigational device exemption, which we'll see a few of today. That basically means the device has been cleared for use for a clinical trial or clinical study. And then the other big category is FDA clearance or approval. An FDA approval basically means that it's usually like an invasive modulatory device that's been approved for use. So that's ready to market basically. Or FDA clearance, which means that it's a safer device that's also received that same level of like market readiness. When you hear FDA device, like breakthrough device designation status, that basically means that the FDA has said, this device is probably going to be a really new, cool therapy, and we want to help this company in getting it to market faster. So the FDA is basically signing up and saying, this is a revolutionary device, and we're going to expedite it for you. So they'll answer questions faster for the company. They'll shorten the requirements for clinical trials and things like that. So it does help get it to market faster, but it doesn't really have anything to do with actual regulatory clearance. But we'll see all three of those today in the regulatory approval section. So one of the first ones, which is kind of near and dear to my heart, maybe this is too personal, but I used to suffer from a very bad depression. And NeuroTechX actually got FDA approval for an at-home neuromodulation device for major depressive disorder. So that means patients now can take these devices home and receive program stimulation while they're undergoing therapy or during therapeutic treatment sessions themselves, which is obviously also really helpful timing given the pandemic going on. So this was a huge one. But I do want to emphasize this is for IDE approval. So this is just a clinical trial for this treatment. That said, because it's an IDE, they've shown some substantial evidence that means this will likely be effective, which is really cool. Another big one that showed up this year, which I remember making its way around LinkedIn and Twitter, it's kind of cool, was the first FDA clearance. So this is actually ready for market of therapy for children with ADHD. So it's actually a video game, which is super interesting. It's the first of its kind, basically a video game used as an FDA cleared treatment. And this is for the kind of attention deficit component of ADHD. So this helps children and adults regulate their attention better. So by playing this game, it slowly improves their attention over time, which is obviously a really cool breakthrough, both for ADHD, but also just for new possible therapies. Now, no longer do you have to choose between being a video game developer and a medical device developer. You can do both. Another big one that I was particularly excited about, because this is kind of my area of expertise, is the Medtronic Percept. So the Medtronic Percept is, so those of you who don't know it, the deep brain stimulation devices have been around for a long time. But up to this point, they've always just been kind of not reactive. We like to call them dumb devices because they just stimulate. They don't read anything about your brain state. They just like stimulate like a pacemaker, just constantly. And the Percept is one of the first DBS devices that can actually read in signals. So they can actually interpret or kind of read in brain signals and use those brain signals to theoretically make a decision on how to stimulate or when to stimulate. And this is really cool because it actually gives these devices better control over stimulating at the right time to give the optimal stimulation, which means they save on battery life, meaning you can have the implant for a longer time without surgery. And it's usually increased in effectiveness. So you don't get any weird tingling sensations or some of the other kind of side effects you might have gotten with deep brain stimulation for motor disorders. So this is a really cool one, both for treatment of movement disorders like Parkinson's and other things that the Percept would address, but also for researchers who want to do kind of chronic deep brain readings from patients. So this will help the therapy be better now, but also be much better in the future. And we're seeing more technologies like this in deep brain stimulation and neuromodulation in general. So another company that has started to do this, for example, is NeuroPace, who's had the ability to read data with their device, and they store all that data and perform these really cool big data analyses on it to improve their therapies. Another cool one, kind of in the realm of user interfaces for med devices, is the Abbott Patient Controller app. So usually people actually had to get a separate phone or even like a separate tablet or some like weird hardware device to be able to control and interact with their neurostimulators. I think Abbott's really revolutionizing this area by allowing people to just download apps on their phones. So in a way, they've kind of beaten Neuralink to the punch here. You can have a smartphone app that controls your brain implant already with Abbott, which is pretty awesome. Another one is this one's a more non-invasive, so kind of backing out of the brain a little bit. The Brainwaves transcranial magnetic stimulation system, so big magnets on your head, has gotten approved. So this is actually cleared, so it's ready for market for addiction. So this, hopefully over the next year, probably a year and a half, we'll start to see this device be able to help people treat addiction, which is obviously really powerful. Addiction is a big problem in many areas of the world. In the US specifically, the FDA is super excited about this device for some of the opioid epidemic and other issues that we're having with cleared painkillers that have been highly addictive. So this is a great thing to come out of not just the HEAL program in the US, which is to address that opioid crisis, but also for other methods of addiction as well. Obviously, this one is also very close to me. I live in Salt Lake City. I live in Utah. I have a Utah array sitting on my desk. So I love this one. Basically, we've gotten approval now. So if this is an IDE, so a clinical trial for the first patients to take home this Luke arm, the kind of highly mobile DECA arm that uses the Utah slant array and the peripheral nerve. And so the Utah slant array is put into the peripheral nerve so that you can have coverage over all the different nerves within the nerve fascicle, and lets you get a high degree of freedom control over this really advanced robotic arm. This is probably a kind of weird one to see on this list because there's no company named here. And that's actually because some of these studies, these IDEs, aren't done by companies, but they're done by the academic institutions behind them. That said, some of the cool companies behind this program include BlackRock Microsystems, who make the Utah array, as well as Ripple Neuro, who's a company actually just down the street from them. They're working together on this haptics program to help make the devices for this type of arm. And then finally, there's actually others, but I was excited to get to this one. NeuroEM showed off a really cool study this year. So this was they received breakthrough device status, which is obviously exciting, but they received breakthrough device status because their first IDE showed really cool results. So they had 6 to 8 patients who took this neurostimulation device home, And this neurostimulation device was previously shown in mice to reverse some of the symptoms of Alzheimer's disease. Specifically, it was shown to break down some of the plaques that form between cells and inside of cells. And they actually saw this, this effect in patients also. So you can't slice open a patient's brain after you stimulate them, but they can see the symptoms of Alzheimer's disease reduce. So this is a super exciting therapy for a really, really impactful disease. And the last one that I'll talk about with a slide is high resolution imaging. So first 7 Tesla MRI scanner, super awesome. Sorry, what? It's a super high resolution scanner. This has been available in research for a while, but this is the first FDA cleared one. So this will let people see much higher resolution of like neurovasculature and microanatomy structures in human brains. So this would be a great way to advance imaging and really help also other areas of neuromodulation, such as better targeting and other things like that. A couple other ones that we didn't talk about in these slides include the Neuralink one I mentioned earlier. So Neuralink got breakthrough device designation this year, which I guess we talked about much earlier in the slides. And another cool one that I was excited about this year, my friend's company, Spark Biomedical, actually got their clearance, 510(k) clearance. So they're ready to market now. And they're producing a neurostimulator that helps babies overcome opioid addiction who are born addicted to opioids from their mothers. So pretty exciting work there. The next thing I kind of want to talk to you about is tech funding. There's been a whole bunch of activity inside of the neuromodulation or neurotech investing space, both from creators and people and kind of more crowdfunding sources like Kickstarter and up into really huge deals that we saw this year. We've seen some of the biggest neurotech acquisitions and mergers this year that we've ever seen. So obviously some really cool movement. So first off, going with the community creators. The first, what we saw at the beginning of the year, pre-pandemic, the Make 100 program, Kickstarter, is this idea to create your own brain-computer interface. So this is kind of a out-of-the-box kit that helps you make brain spellers or joystick controllers. So you can actually, it's almost like a dev kit. You can pair it to your own apps if you write those and create your own app control for things that you write, which is really cool. Another one that I was really excited about is the Brink Bionics. This is an impulse neurocontroller for PC gaming. Effectively, it's a glove that you wear around your wrist and it senses the beginnings of muscle or nerve movements and allows you to register a click on your mouse, depending on which fingers you're choosing to use, up to 80 milliseconds faster than actually getting your muscle to execute that movement. So I don't know if any of you play like Valorant or Counter-Strike, but 80 milliseconds, I think that would give you a pretty solid advantage. And 306 other people agreed, pledging to this one. And then finally, a pretty interesting one. Interested to see how well this one works out is Happy. This is a device, basically a headband that's supposed to allow you to choose how you feel. So you basically can program in a mood that you want to feel, whether it's happiness or tiredness, or maybe like contentedness, being relaxed. And it helps kind of program your brain through stimulation to achieve that state more easily. One of the next ones that I'm seeing here is Rune Labs. This is also another friend's company of mine. In fact, the CEO and I are in a cool peer group together, so I see him every week. Rune Labs is effectively I want to call it, the easiest way to describe them is a cloud storage solution for neuromodulation data. So they'll partner with companies that generate neuromodulation data, let's say a NeuroPace or a Medtronic or an Abbott, or even companies that generate more distinct neuromodulation data like BlackRock Microsystems. And they'll kind of be like the Dropbox for that neural data. And you can create your own data analysis routines or kind of like processing routines and upload them to that Dropbox. So as the data is uploaded by your patients, it goes through that analysis stuff and you can just download the results. So they're working on all sorts of cool platforms. They have these cool APIs that allow you to just program these things into your devices and pipe the data straight to their servers. And because of that pretty innovative approach to data management, they closed a $5 million seed round this year. And for having only, I think, 11 employees, that should last them quite a while and help them scale up some of that infrastructure. This one is also close to me because the EEG lab that I started actually was an electrical geodesics lab. So electrical geodesics was known for their high channel count neural nets. And MagStim, which was a company that traditionally just made transcranial magnetic stimulation, acquired EGI to basically round out their stimulation portfolio. So now they can use these high resolution nets to do kind of like complex TCDS or other like stimulation routines through these nets. And so now they have stim and recording through the nets and their mag side. So that was a pretty good strategic development. Neuroviolence is a company that is developing another non-invasive therapy, which I think is pretty exciting. One of the things that they're developing for is weight loss, but also insomnia, which I think I could use a device for. I've had some trouble sleeping lately. But this $5 million funding for a non-invasive company will help them really expand a lot of what they're doing. But specifically, one of the things that's really hard about running clinical trials is you're kind of limited in, so I'm going to rewind a little bit. You can make a clinical trial go as fast as you want, pretty much, by adding more money into it. Because typically what's limiting you in your clinical trial is how many sites that you've signed up to be able to administer the clinical trial. And the more money you have, the more sites you can sign up, the more clinical trial managers you can sign up, and then you can run more things in parallel. And so that's what this funding is for, is to basically speed the pace of this device by allowing them to run more clinical trials simultaneously. So this is a super exciting one for them. NeuroTechX, this is a company owned by Dan Rizzuto. This work came out of the DARPA RAM program. If you haven't heard of it, DARPA is a really cool funding agency in the US that basically helps fund really high ambition, but maybe really difficult programs. And in this case, they launched a program called RAM, or Restoring Active Memory. And it was a program to try to create a neuroprosthetic device to improve memory. And one of the winning teams was the University of Pennsylvania team. They had 6 sites throughout the US. I helped them set up some of these trials and train some of their sites and wrote some of their software, I guess, to get this off the ground, which was really cool to be involved in. And they actually were able to show that they can restore memory in patients with traumatic brain injury. So given that there's 6 million people just in the US that live with traumatic brain injury caused memory loss, it's a really cool company. So this 1.5 million in funding is basically being used to help them complete their engineering phase. So to take some of the learnings that they got from that academic trial and turn it into an actual device. And then they'll be able to go into another proper clinical trial using the new device. Something that we don't talk about here, but actually did happen earlier this year, was NeuroTechX used a previous funding round to acquire Cortera, which was a company that started out in California that basically created some of the internal electronics that are used for this device. And finally, this is, I think, technically the biggest funding round of the year. So there's a company called Iota Biosciences, which also came out of DARPA programs. It came out of the NESD BISC program, which was a program that was created to form, basically the company Iota pitched this idea of neural dust. And the NESD BISC program was asking for the ability to record from the brain really broadly. So many channels over many areas in the brain. And Iota Biosciences proposed neural dust, which are, as you can see here in this picture, are these tiny little electrodes that are wireless. They're powered through ultrasound, and then they respond with data using that ultrasound reflection. So it's a really cool tech, but it's a really hard engineering challenge. And Iota did pretty well with the DARPA program, but then they got a huge investment from this company called Astellas, which is the Japanese investment firm. And Astellas originally invested in Iota and helped propel them over the last couple of years. But then this year, Astellas went all the way in on Iota and purchased them basically for $450 million. So that's $150 million to buy out the rest of the company, another $150 million for shareholders, and then another $150 million just for further development over the next 3 years. So it's a huge injection of funding to this technology. We won't see anything from it for quite a while, but when we do, it's going to be fantastic, and they have the money to do it. A couple other big funding opportunities we didn't get to see in these slides included the Verily funding. So Verily is Google's kind of health arm, and they actually got a $700 million injection this year. Not all of that went to neurotechnology. In fact, most of it, I think, went to COVID stuff, but still a really big thing for some of the neurotech departments within Verily. So super exciting stuff. I'm really excited to see what comes from all this funding. And I'm also excited to pass it over to Morgan to tell you a little bit more about some other NeuroTechX initiatives, as well as the competition.
Thanks so much, Nick. And yeah, I'm Morgan. I'm the chapter lead in San Francisco, and you might know me from YouTube videos on the NeuroTechX channel. So let me just, well, before we get started, just want to say that yeah, we'll be covering some of the community projects that have taken place this year, and it's a real pleasure to present this section, as it's probably, you know, of the pillars, this is the one that brings me back to NeuroTechX all the time. So let me just see if I can get that right. Am I? So, sorry. So the first challenge that happened this past year was the Neureka Epilepsy Challenge, and this was a data set from the Temple University Hospital EEG corpus, and crowdsourced in the sense of an open competition for anybody who had the bandwidth. It was looking at seizure detection with a scoring program developed by Joseph Bacone's group at Temple University Hospital, and the winners of which, you know, it was a great competition. I learned a lot in terms of how this was scored. You know, it was there was a kind of basic ROC like sensitivity specificity, but in addition, there was the ability to reduce the number of channels that you use. These were typical 1020 recordings, and so there was a real difference in terms of, I think the Biomed regulars used all 16 channels, or they used 16 channels, and the Sydney team, I think, used 2 or 3 channels. But both achieved great performance, and it was a real success, given the fact that they were, I think, about a month or month and a half time in terms of development. So this was another kind of community project. This wasn't run by NeuroTechX, but we had the pleasure of interviewing, you know, we had Mike Parada from Neosensory on the Neurotech San Francisco Hack Night, and this was they're running a second competition now. I think this is the winner of the first competition that was in the fall. And for those who aren't familiar with the Neosensory buzz, or some of David Eagleman's work with live, you know, his recent book is Livewired. This is a device that turns sound into these 4 vibrational sensors operating at different frequencies, and it's using their proprietary algorithm, but it gives you, yeah, the wristband, you experience sound as touch, and can, especially for the deaf community, this can, or hard of hearing, you can provide real new awareness to sound around you. The competition started putting additional kind of sensors together with with the buzz. And so one of the winners was this air quality sensor. There are lots of other great examples that you can find on their website. So a couple of the runners up I see here are emotion recognition, sensing AC electric fields, and certainly one of my favorites here is, of course, the obstacle detection. And there were a few projects trying to do some EEG related, at least kind of biofeedback like projects. There is a second developer competition actually just finished up, where I think it was the 15th, and so we'll be seeing some additional winners together with Edge Impulse, I believe, and Hackster.io. So of course the big competition that I always look forward to is really the student clubs and their incredible work. So the student competition's an annual event, and the student clubs are such an important part of the NeuroTechX community. The two challenges are the open challenge, which I believe emphasizes a certain kind of creativity of the use of technology, and the fixed challenge, which focuses on kind of the breadth and depth of the technology used. So I believe Mint is the UBC team, which somebody can correct me on the chat. Yeah, I'm always super impressed by the work of the student clubs, and I would also just like to point out some of the student chapters here in California. San Diego in particular is also running a Kaggle competition that, together with their data science society student club, that is also has been super impressive, as is the Neurotech at Berkeley chapter, which is running their own course for other students. So BitBrain put out a call for projects this summer, and so up to 150K euros. BitBrain is a Spanish hardware company, EEG company, and additional products could be received from Tobii and PST. So this is the makers of eye tracking devices, and the E-Prime, although PSD does make other things than the E-Prime, especially for experimental control inside MRIs. And yeah, that wrapped up this fall, and I believe the kickoff is starting last week. And of course, this is a huge event. The Cybathlon at ETH Zurich is always amazing. It's very well funded. We're very well. Incredible engineering takes place here, and a variety of competitions. Like the sophistication of the scoring in the Neureka Challenge. There's just a variety of measures in which these particular pilots or operators are rated, and which the devices are tested. And we've had pleasure of, I got to talk with some of them who were also at BCI Samara, but Giacomo Valle, I know, has joined us at NeuroTechX Paris, and to talk about my leg and the sensory feedback lower limb prosthesis. But always an incredible event to catch, and incredible companies to follow up on. So the community efforts that have taken place this year, I've got to say it's been a terrific year. So one, of course, like all of us, we saw the very large movement that started in the United States, but spread worldwide, looking at racial injustice in particular. And it really spurred an internal discussion at NeuroTechX about what can we do. We are an open community in which anyone can become a member, and there's no fees involved. But at the same time, that doesn't mean that we are necessarily making it fully accessible and cultivating the diverse community that we really want. So a number of us, led by Abby Holland and others, Maria, have started this initiative, and the diversity committee has had its first meeting at the end of last year, and really looking forward to seeing what comes, what initiatives that we can, what action we can really take this year. So, kind of more technical community project. EEG Notebooks has had its first hackathon or code sprint, and I've got to say it was a pleasure to join that as part of BrainHack Ontario. John Griffiths, who's one of the chapter leads at NeuroTechX Toronto, is also the maintainer of GitHub, and a big kind of part of the 2.0, or the new release of EEG Notebooks was Jaden Tridup and the work of Andrei Parfenov, who's the BrainFlow developer, adding a whole host of new devices. So EEG Notebooks started as many technical projects at NeuroTechX started as an Alexander Baruchel project. Probably others, and forgive me if I'm not getting all the history right on this project, but Muse LSL was I think the first project, and this was a combination of the names in terms of being able to get raw data from a Muse and stream it with LSL, and also provide events and event timing and to some degree some analysis processing with the M&E. But yeah, what really changed with Jaden bringing in BrainFlow as an interface was opening it up to additional devices like OpenBCI, BrainBit, Neurosity Notion, GTech Unicorn, and we've still got more to even test out. And there's like the John Griffiths picture shows, with the revolution taking place there. What we're really trying to do, and Alexander's original motivation for this was making some EEG device, consumer grade and low cost devices, able to do what we were doing with research grade EEG, right? And event related potentials in particular. And to do that without trigger controls and other kind of hardware. So there's plenty of other people that have contributed to this project too. I just want to point out Kyle Matheson's work in bringing all the Mac support and some other great deep learning examples and the visual attention task. And Eric Berholt, who's also given us some great continuous integration support that we really appreciate. So the other Alexander Baruchel project that we've really rallied around this year is MOAB, or the mother of all BCI benchmarks. And this one is also pretty personal. I remember the first community meeting on this back when I was still in the UK, and I was so impressed that he was starting this project, and so surprised that this hadn't been done before in research, in the research world, But as Alexander pointed out, right, that so much of BCI research, and honestly, you can see this today in terms of opening up any of the kind of pick a recent archive paper of BCI machine learning, and too often the code is not available, right? Or they're using some data formats that aren't accessible, or toolboxes that you can't use, or to use those toolboxes is a lot of work in itself, and those don't come with appropriate support. And then in addition to that, you don't, even if data sets are available, it's not clear how the data was pre-processed. And, this can make a huge difference in terms of the kind of machine learning that you do. And we see this a lot in the NeuroTechX challenge, right? In terms of how much the pre-processing can aid, how much the feature engineering, if you will, can change the ML problem that you have. Then in addition, there really weren't any comparisons being done. And, we had a great speaker join us at NeuroTechX San Francisco to talk about his work on SSVEPs. And, so he for his master's work at University of Waterloo, Arvind joined us and talked about how, he was really happy to get a publicly available data set processed, and to, be able to add one additional pipeline in addition to what he developed, and what you'd really want is to, be able to see each new paper should be a contribution to the kind of BCI algorithms that we can compare against, in much the same way that ML researchers on image processing are better at in terms of making their pipelines available. And we could say more about that later in terms of it sometimes it is still hard to run their pipelines too. But certainly, this is one of my favorite projects to highlight, in the sense that, like, this is a project that makes the community, everyone who uses it will be better for using it. Your algorithms will be better. You'll be able to look across more publicly available data sets. And so we give a kind of consistency across pipelines and consistency across data sets that is, I think still unique, even though this project is rather old. So please join us. So at the top there is Alexander Berachon, Vinay going anti-clockwise is Vinay, and then Sylvain Chevalier is there, who's the current maintainer of the GitHub project. And please find us on Gitter. Sylvain runs a weekly developer meeting Thursday evening European time. So for La Paz, that would be 1:30 p.m. on Thursdays. And yeah, there's a regular group that are meeting now to try and extend this framework. So the content laboratory is also a new initiative this year. This is a new initiative this year. I know, I remember seeing this start. I don't know if, we've got publications upcoming, but certainly it was, I think, an internal attempt to provide that kind of unique content that comes from this really diverse set of, diverse community with different experience in terms of developers, writers, marketing, and graphic artists. And I'm super looking forward to seeing some of the output here. And I also want to just point out, the for us is the new NeuroTechX Barcelona co-lead, has been doing this wonderful series on neurotech design that I'm sure will be reflected in his upcoming publication. So yeah, this slide really represents what it's been nice to look back over the past year and just remember how many incredible events took place. I think before the NeuroTechX Challenge, we had the NTX BCI 101 series with just a wonderful set of speakers with some very famous names from Moscow joining, and wonderful presentations and wonderful socials. I think I don't know if that was the first time that Neurobar was used as a social, but the conversations afterwards as part of that were terrific. And certainly it was wonderful to see how many new chapters came online too, right? So the NeuroTechX India, Berlin, Australia, Zurich, Barcelona, the design series, neuroethics, Amsterdam, and Jason Farquhar with Mind Effects was one of the speakers, and the Neurovision Consciencia, excuse me, and NeuroTechX Galicia. What a range of topics and range of experience that the different chapters are bringing. The NeuroTechX gaming series had another set of unique speakers, and in addition, the student clubs, again, the NeuroNexus, I got to participate with one of the groups as a mentor to the Libre board, which ended up winning that industry competition. Another excellent, kind of startup example, startup experience for undergraduates together with industry and developer mentors. It has been a really impressive year to be a part of the community. And I've got a few extra slides here. We'll have the chance to perhaps ask Nick a few background questions about this in terms of, I think one of the real, having seen NeuroTechX over 5 years, I am impressed with how much kind of invasive recordings have really taken the limelight of neurotechnology this year in particular. And I'm curious about the software, research software in particular, that is open source and publicly available to the community that addresses at least some of these particular features. So hopefully we'll be able to ask Nick more questions about that. Google Amber is a project that I'm particularly interested in as somebody who's coming to neurotechnology from psychiatry. This is Alphabet's X group, which is their moonshot group, right? And it's their corporate DARPA, if you will. And Project Amber's moonshot was finding an EEG biomarker for depression. So there's a number of things about this that I like for NeuroTechX. One is that they were releasing a full stack, right? And this is something that we've been trying to also foster in the community, with things like Free EEG 32, which has brought together a group of developers from all sorts of chapters, across, global chapters, from Dimitri in Moscow to Josh in Alaska to Bernard in north of Amsterdam to others, to Devesh in India. It's brought a number of people together, and we could still, we're learning a lot from just how they released their particular hardware, as well as what we could use from their device. So they've released both the hardware and the experimental control software and now and acquisition software, which is some of the things that we see in EEG notebooks, but also in projects like M&E CPP and some software that we've again considered using for EEG 32. It's also interesting because of the machine learning pipeline that was developed for Google Amber. For Project Amber, was developed by co-developed with researchers from DeepMind, and there's a lot of really interesting work that puts their particular pipelines, and anybody who is interested in reading it really focuses you on the latest research that's coming out of meetings like ICLR. I think all of Irene's papers that fed into this were all ICLR papers up until this year, and we'll be looking for more of them in April or this spring. So yeah, it's been 5 years. I remember quite well being a part of this in the very early days, and just a shout out to all the people that introduced me to NeuroTechX, like Marion and John Nolte, and others that in the garage here in San Francisco. It's been incredible to see this community grow. So if you're not already, please make sure you join us on Slack and check all the various social media references here. And I will turn it over to Manuel.
Great, thank you, Morgan. Thank you, everybody. Well, we have a couple questions I would like to address before we jump into our networking session in GatherTown. First of all, I think this is an open question for everybody. Whoever wants to respond, and better if everybody wants to participate, is that, would you get an implant yourself, and why? I guess it's addressing Neuralink type of technology. I don't know. What is your opinion on these, guys?
I guess I'll start my video so you can see the truthfulness in my face. I think for me, it depends quite a bit on what the benefits of the implant claim to be. And usually it's kind of a risk-benefit ratio, because I can definitely tell you that surgery comes with its own risks in general, no matter how non-invasive or minimally invasive rather, or not even minimally invasive, but quick that Neuralink makes it. There's still always a chance of bleeding or anesthesia issues, things like that. Also, generally putting anything into the brain, you're getting some sort of neural cell death, and that's kind of concerning. But I think a lot of these implants are at a point where the types of benefits that they're approaching, I would definitely take, especially for some of these medical issues like Parkinson's or Alzheimer's disease. I would definitely get one.
Great. Any of the other panelists would like to answer?
Yeah, I mean, I guess I'm on the same boat as Nick. I would definitely get one for medical purposes, but I guess just for recreational purposes. I mean, there's, as you mentioned, there's the riskiness of the surgery, but also I guess I'm uneasy with just giving. I guess it's still an open question of how my data would be used, right? And I feel like neural data is very precious, and me losing control over how that's used and whether it's totally beneficial to me I feel like that's another risk to put into the equation that makes me be like, well, maybe I wouldn't do that unless there was a medical reason.
Great. Somebody else would like to answer?
If I could, I just wanted to, talk about something that did come up in the Neuralink examples, which is, certainly some psychiatric disorders have been proposed as kind of targets and stimulation, and it's a new area in terms of deep brain stimulation for things like schizophrenia. This is starting, good research is starting to happen now. I remember seeing the first job postings on this and getting in touch with people and saying, like, I love the fact that you're doing this. What's your target? Because so that's one, certainly one area in which I felt like it was, some of the Neuralink examples were perhaps too far reaching. And I liked what some of the vision researchers that work at Neuralink were saying, where it's just like, we'll probably be giving people, the ability to see again before we're tackling things like mental health. And so just want to add that.
Okay. Brian, would you like to share with us your opinion regarding this? Or maybe we can just go to the next question. Okay, so this is for Nick. Regarding the considerations of the use of a stimulation device for depression treatment, who shouldn't use it? I guess this is referring to the dangers of, what are the dangers of using an stimulation device? Can it produce damage to brain tissues or long-lasting effects, unknown effects?
That's a good question. So for that specific device, I don't know all of the warnings or precautions that one must take before using it. I can say that TCDS and other kind of similar stimulation types have been seen to be relatively low risk. The energy levels used basically are insufficient to really cause neural damage. It's not like you're going to burn neural tissue. You can stimulate through the skin. More what you're creating are electrical fields that kind of bring the neurons in certain areas closer to their threshold, making them more likely to trigger in certain brain regions. Specifically, the way that a lot of these devices work is they're actually trying to elicit or kind of bring about patterns of oscillation that are healthier or more correct, or disrupt patterns that are overly synchronized. And so all you're kind of trying to do is usually take this TCDS or pulsed magnetic stim and try to change the oscillatory activity a little bit. And so overall, the chance of it leading to something that's really problematic is probably really low. But usually that's why it's used in conjunction with other methods of therapy, like cognitive behavioral therapy, because more what it's kind of seen to do is basically help you create new neural connections that are more healthier and in line with the type of thinking you want to have. And so, for example, for major depressive disorder, you may have errant oscillatory activity in some of the emotional processing regions. And this can help you as you're going through therapy and finding ways to think and kind of register and happier thoughts. It can help strengthen those connections a little bit better. And so it kind of falls in line with the same, I guess I would say, common thread that we see in TCDS and non-invasive therapies, which is that they help encourage new neural connections or basically increase plasticity. which is why so many non-invasive devices are advertised as learning devices.
Great. So going to the next question, I guess this is for Cesar. Are parents willing to lend their babies to science? I guess this is regarding to the newest device you presented.
Yes, there are several labs that conduct research on infants. I mean, the parents are usually there. It's a very careful process of making sure the infant is comfortable and that the parents are comfortable and that they give consent to everything. And it's usually, you know, usually the experiments in which the children participate, they're designed to be games, so that they're engaged and, you know, not afraid of what's going on around them.
Okay, great. So safety is important, right? Going to the next question. I guess this can be answered by anybody. Can neuro data be patented?
So I posted a thing in the chat, but I'll repeat. There's nothing so far preventing a company from doing this. You know, I mean, someone tried to patent genes, and you can imagine a scenario where you know, tomorrow a company figures out that if they maybe create a pattern, a neural activity pattern in a region of the brain, you know, they can cure depression, and then they try to make it such that, you know, they have the patent over this pattern of activity, maybe not just the device. So we want to you know, preempt those scenarios, you know, with putting regulations down, especially as this technology becomes more and more widespread.
Yeah, sure. Thank you. Now we have the last questions. If somebody has more questions, you can make them in the networking session after that, please. Will we ever get rid of the medication for ADHD treatments with this kind of technological therapies?
Probably directed to me, given that I mentioned some of the ADHD breakthrough stuff, including the video game. I'd be interested to hear some of the other panelists' opinion on this, because I don't know if I have all the expertise in it. I think what we're seeing a lot of, for especially these cognitive kind of behavioral therapies, such as a video game that helps increase attention, is that they modulate the effect of drugs or therapeutics. So instead of having to prescribe such a strong dose of, say, Ritalin, I think is a commonly used one for ADHD, you could do a reduced dose, which helps reduce symptoms and also some of the other negative effects associated with that drug use, while still getting the same kind of like cognitive benefit. And so we see that in other places too. For example, people in Parkinson's disease, even though they get DBS, sometimes they still supplement slightly with medication. Similarly, we oftentimes see people on antidepressants working through some of these like TMS therapies and things like that.
Great.
Yeah, I was just going to follow up. I mean, I think that pretty much says it. You know, certainly in psychiatry, there's you know, dealing with yeah, you're going to usually use all the tools at your disposal, and certainly medication together with some training is usually found to be more effective, significantly more effective. And that, you know, a lot of so medication gives you a boost, and some of the behavioral work that you're doing is to some degree dealing with learning issues that have developed around coping mechanisms and things like that, as well as sharpening focus and other other kind of goals of treatment. So, you know, some of the examples in schizophrenia are really treatments that are aimed at improving cognition on various metrics, even though, you know, the neurotransmitters or the medications that are being used aren't necessarily targeting those things.
Great. Well, before we go to our networking event, I would like to show you a little bit so you get familiar. If you can see my screen now, you are seeing a map of the gathered town space. So you get an overall idea. You will spawn here in the lower proportion of the map where you can find help. We have the NTX help desk to answer any of your doubts, either on English or on Spanish. Then we have the main NTX hall where our next panelists will be sharing the demo of their products. And then we have the NTX lounge where we can chat and you know, waste a little bit of time. So if I don't know if you can see now the link to the Gather Town space and the password. We can start going now, and we can stop streaming. Thanks. Thank you, everybody. Si todos pueden ver, ahí tenemos el enlace al espacio en GatherTown. Por favor, una vez que ingresen, no se olviden poner un username, que sea claro, que sea su nombre, prender sus cámaras, prender sus micrófonos y preparar preguntas, preparar cualquier duda que tengan para los panelistas que tuvimos durante la conferencia o los panelistas que nos van a dar la demostración de sus productos. Hasta que todos puedan entrar, un par de moderadores nos quedaremos aquí en la sesión de Zoom, ayudando a todos los que tengan alguna dificultad o alguna pregunta sobre cómo unirse.